Thank you for watching the video. This is YouTube Medical University. You wouldn't expect it, but things like this can appear on your eyes, elbows, or Achilles tendon. Who knew these signs signal plaque buildup risk? As people say, we age with our blood vessels. As we get older, our vessels age, plaque and fat collect, and clogged vessels raise the risk of heart attacks and strokes. To enjoy the second half of your life, to travel, eat delicious food, and live vibrantly as yourself, it's very important to prevent the aging of your blood vessels. However, with arteriosclerosis, if your blood vessels become clogged, the symptoms can be severe, and often by that time, it's already too late. There are almost no symptoms right before a blockage occurs, but there are some signs you should watch out for. Also, I think it's important for everyone to know that if you have certain physical characteristics, you might be at higher risk of your blood vessels becoming clogged in the future. I've seen families regretfully say, if only we had known sooner, we could have helped our loved ones. For example, please take a look at this image. This is called xanthelasma, which is a change where fat or lipids accumulate on the eyelids. Please take a look in the mirror and check if you or anyone around you has this characteristic. Conducted in Denmark in 2022. The study found that people with this change called xanthelasma, compared to those who do not have it, whether they were in their 40s, 50s, 60s, or even in their 70s. There are reports that their risk of future myocardial infarction and related death was higher. For example, among people in their 70s, the 10-year risk of myocardial infarction was 19% for those without xanthomas, but it was clearly higher at 28% for those with xanthomas. Knowing this may make you realize you need to be more careful than others, as it can cause arteriosclerosis. It might also change your mindset about being careful with things like blood pressure, cholesterol, and blood sugar levels. By the way, if this xanthelasma appears on areas like your elbows or knees, this is called familial hypercholesterolemia, where cholesterol levels become high due to genetic factors. It's included in the disease's diagnostic criteria along with similar changes. Can you see that the Achilles tendon is clearly thicker? If the thickest part of the Achilles tendon measures more than 8 mm in men or 7.5 mm in women on an X-ray, this is called Achilles tendon thickening, and this is also included in the diagnostic criteria for familial hypercholesterolemia. You might not think changes in your elbows, knees, or Achilles tendon are linked to high cholesterol. Who knew these were signs of a genetic disease? At YouTube Medical University, we always say knowledge is a weapon. We share useful knowledge like this that can help you become healthier starting tomorrow. So if you'd like, please subscribe to our channel so you don't miss any of our new videos. In first period today, I'll share 3 signs plaque may soon clog your arteries, and in second period, we'll discuss what causes plaque. I'll introduce methods to lower cholesterol and triglycerides. In the latter half of the video, I'll also introduce foods and supplements that I personally recommend and use, so please make sure to watch until the end. Let's begin. Here is the first of 3 signs that plaque may soon clog your arteries. It's called intermittent claudication. The name may sound complex, but it's simple. It's a condition where leg pain occurs while walking, making it hard to continue. Our bodies are covered with blood vessels all over. If you include the capillaries, the total length is actually as long as the Earth. The body's blood vessels could circle the Earth 2.5 times. And the farther blood vessels are from the heart, the thinner and finer they become. The thinnest blood vessels from the heart are the ones in your toes. When your triglycerides or cholesterol are high, the risk of these blood vessels getting clogged increases, and actually, symptoms can sometimes first appear in your feet, which are farthest from the heart. Your feet are often called the second heart because they play a very important role in pumping blood back up from your feet to your heart. If you ignore the early symptoms that I'll talk about next, in the worst case, blood vessels in your legs can get blocked, sometimes requiring amputation. I've seen many like that. So, what kind of symptoms appear when the blood vessels in your legs start to get blocked? After walking for about 5 minutes, you may experience leg cramps, your legs may seize up, or you may feel pain in your legs. If you stop and rest for less than 10 minutes, the pain goes away, so you start walking again. But when you walk, the pain comes back and you have to rest again. Sometimes your leg blood vessels may narrow. Why does this happen? Why do these symptoms appear? It's because when you move your legs, you use your leg muscles. To move your leg muscles, you need a lot of energy, which means you need a lot of blood flow. However, if the blood vessels in your legs have become narrow, there isn't enough blood flow, so you experience pain or cramps in your legs. If you think about the reason, it might be easier to remember, and there's also a way to check it quickly without having to walk. That is to check for coldness in your legs. If your feet are extremely cold compared to your hands and feet, or if one of your feet is cold. This could also mean that arteriosclerosis is progressing and blood flow is decreasing. Please, while watching this video, try touching your feet. There are also other methods like this. As shown in this photo, try touching the area between the base of your big toe and second toe on the back of your foot with your index and middle fingers. You might be able to feel the pulsation of the artery. This is a normal response. However, as arteriosclerosis progresses, you may not be able to feel the dorsalis pedis artery, which is the artery on the back of your foot. This also indicates worsening arteriosclerosis in your legs, so please try it. However, this blood vessel can be hard to feel if you're not used to it, so not feeling it is normal. That doesn't necessarily mean your blood vessel is blocked. If you think something is wrong, I recommend consulting a hospital. You might think that because it's a symptom in your leg, it's not a big deal, or that it'll get better if you just leave it alone. But if you judge it that way yourself, as I just mentioned, your leg might actually start to hurt when you walk. If you have symptoms like these, when we followed up with 100 people, 5 out of the 100 ended up having their leg blood vessels blocked and were forced to have an amputation. And of those, 3/4 or 75% in the future, there are even research results showing that 3/4 of them developed diseases where the blood vessels in the heart or brain became blocked. It's just your legs, but your legs are important. To keep walking lively on your own feet in the second half of your life, if you have any of the symptoms I mentioned, please consider seeing your regular doctor or a nearby internal medicine or cardiology clinic. There is a simple test called ankle brachial index to check your blood flow. This method compares arm and leg blood pressure to assess leg blood flow. If the results of that test show that the blood vessels in your legs are actually starting to get clogged, there is a treatment called catheter therapy where a stent is used. Treatments like widening narrowed blood vessels are performed. Here's the second of 3 signs that plaque may soon clog your arteries: a transient ischemic attack. Have you heard of it? The name is complicated, but here are the symptoms. You may briefly have trouble moving your body, experience numbness, or have difficulty speaking. You had symptoms, but after about 5 to 10 minutes, they completely disappeared. When symptoms similar to a stroke appear temporarily like this, it is called a transient ischemic attack. What happens in the brain is that small plaques, blood clots, or thrombi temporarily block a blood vessel in the brain, but they gradually dissolve, so the symptoms remain temporary. Some people might think it's fine if it dissolved. However, this is actually a strong warning sign that a stroke may occur later. Just because the symptoms are gone, don't ignore it and forget about it. If you notice anything unusual, please consider visiting your regular doctor or a neurosurgeon immediately. There is something called the golden time for strokes. That is 4.5 hours. When a stroke occurs, brain cells become deprived of oxygen and start to die off rapidly. Once this damage occurs over time, it cannot be reversed, and paralysis or other after effects of the stroke will remain permanently. If the blood clot can be removed or medication given soon after onset, the brain tissue at risk of dying, brain cells may recover, making symptoms like paralysis more likely to improve. As I mentioned earlier, people with symptoms like a transient ischemic attack should generally be hospitalized and undergo various tests to check for any risk of blood clots. If necessary, they should be prescribed blood thinning medication to help prevent future strokes. Let me introduce 3 typical symptoms of a transient ischemic attack. Surprisingly, the first symptom involves the eyes, such as vision trouble in one eye or deep eye pain. Your vision might suddenly go completely dark. These symptoms usually improve within a few seconds to a few minutes. If these symptoms improve within an hour at most, this could be a warning sign that you're on the verge of a stroke. This symptom is called amaurosis fugax. For those who have experienced the symptoms I just mentioned, believe it or not, within 3 months, 10 to 15% of people have a stroke, and half of those strokes occur within 2 days after the eye symptoms appear. The cause of this kind of amaurosis is called carotid artery stenosis. It happens when the two important large blood vessels in the neck are getting clogged by cholesterol plaques. Whether the blood vessels in the neck are getting clogged can be determined by doing a carotid artery ultrasound, which is an ultrasound of the neck. Even if there are no symptoms, there is data showing that about 10% of elderly people have narrowing of these neck blood vessels. For more, see my video, Signs that your neck blood vessels are about to get clogged. Watch the video later if interested. Another sign of a transient ischemic attack is slurred speech. You might wonder if that person is drunk because their speech is slurred, but in such cases, it could actually be a sign of a stroke or a warning sign of a transient ischemic attack. Along with slurred speech, you may struggle to find the right words or suddenly be unable to speak. Aphasia is when you can't express yourself with words. For example, you may picture something but can't name it, like calling a remote control just that thing. These kinds of symptoms can actually be signs of a stroke. There's a simple test to check your articulation where you repeat the word pataka several times. Pataka, pataka, pataka. If you suddenly can't say this properly, it could be a sign of dysarthria, which may be an early symptom of a stroke. Please make sure to check for this. The final symptom of a transient ischemic attack is numbness or paralysis. A characteristic is that it often appears on one side of the body. Numbness in one hand or one leg, numbness in the mouth, or difficulty applying strength. These kinds of symptoms could also be warning signs of a stroke. In my own experience, there have been people who only had numbness in the mouth, and when we checked, it turned out to be a stroke. People often associate stroke with sudden loss of mobility. You might imagine severe symptoms, but it's actually quite common for minor things to be symptoms. Sudden numbness on one side, weakness, vision problems, or slurred speech can all be signs. Please remember these symptoms. Here is the third sign that plaque may soon block an artery. The symptom is feeling chest discomfort when walking. If you've been studying with YouTube Medical University, you probably already know this. With angina, when the blood vessels in the heart are getting clogged, you start to feel chest discomfort while walking. The heart is a mass of muscle. It contracts thousands or even tens of thousands of times a day. Because of this, it uses a lot of energy and has a rich blood supply. When the blood vessels that supply nutrients to the heart are getting clogged, you feel chest discomfort when you walk. Those kinds of symptoms can appear. However, the tricky part is that even if the heart's blood vessels are half clogged, there are no symptoms. It is said that symptoms are more likely to appear when about 3/4 or 75% of the blood vessel is clogged. And what's even more troublesome in my experience is that sometimes people say their left shoulder hurts or they feel pain around their jaw. There are actually cases where, even without chest symptoms, when examined, it turns out that the blood vessels of the heart were becoming clogged. These atypical symptoms occur in the shoulder or jaw instead of the chest. This is more common in women, the elderly, and people with diabetes, especially those without symptoms but with clogged blood vessels, so please pay attention. If you have symptoms like a tightness in your chest or a feeling of pressure that continues, these can increase your risk of a future heart attack. In fact, about half of the people who have had a heart attack actually experience symptoms like these 1 to 2 months beforehand. Knowledge can be a weapon. Make sure not to overlook these kinds of symptoms, and if you have any heart-related symptoms, please consider visiting a nearby cardiology clinic. If tests like an electrocardiogram, heart ultrasound, or catheter exam reveal blocked vessels, treatments such as widening them with a catheter or balloon or surgery to connect vessels will be done. This is a review of the first period. Plaque buildup can nearly block blood vessels in the legs, causing intermittent claudication, leg pain or cramping when walking. The second is a transient ischemic attack. Suddenly, you may have trouble seeing out of one eye or lose strength. I explain symptoms such as slurred speech. And third, angina pectoris. When walking, you feel a painful, tight pressure in your chest. I also explained about symptoms like those, as well as atypical pain in the shoulder or jaw. So by noticing these signs right before a plaque gets clogged, it's important to get treatment. However, what's really important is to prevent arteriosclerosis and the growth of plaque in the first place. Hospitals, by their very structure, receive medical fees by diagnosing and treating illnesses. Hospitals often fail to explain how to prevent diseases. Taking preventive steps during the mebio or pre-disease stage is crucial for reducing future risks. In part 2, we'll focus on current topics of interest. Reducing triglycerides and cholesterol may lower the risk of vascular blockage diseases and could also benefit blood pressure and stress. I'll add some special ingredients. In fact, what I personally consume every day is this: fish. The nutrients found in fish. The fat called fish oil is a magical fat. It contains very good fats called docosahexaenoic acid, and icosapentaenoic acid, which are part of the omega-3 fatty acid group. It's especially common in blue-backed fish. Recently, more and more new research has been conducted on these omega-3 fatty acids. They lower triglycerides, reduce cholesterol, and help decrease blood pressure and heart rate. And they're even starting to be expected to work as a treatment for depression. That's how beneficial these nutrients are. According to a highly reliable paper, a meta-analysis that gathered 11 studies, people who eat fish more than 4 times a week have a 21% lower risk of developing diseases where the blood vessels in the heart become blocked, such as myocardial infarction, compared to those who do not. And what's more, the risk decreased by 5% for every 100 grams of fish consumed per week. The more you ate, the better it was. That was the conclusion they reached. Isn't it clear that we should be eating fish? So, which nutrients in fish are beneficial? Many studies have been conducted, and as expected, the nutrient that's getting the most attention is icosapentaenoic acid, one of the omega-3 fatty acids, mainly in the United States. According to clinical trials conducted in 11 countries, about 8,000 people who took 4 grams of icosapentaenoic acid per day were compared with those who did not take it. After following them for about 5 years, the group that took icosapentaenoic acid had about an 18% reduction in triglycerides compared to those who did not take it. There are reports that the risk of myocardial infarction was reduced by as much as 25%. It is believed that consuming fish, and especially icosapentaenoic acid, may be effective in preventing arteriosclerosis in the future. But that's not all. The group that consumed these omega-3 fatty acids and the placebo group that did not consume them were compared with the group that took a placebo. There are several highly reliable papers called randomized controlled trials. According to those results, omega-3 fatty acids lowered low-density lipoprotein cholesterol, also known as bad cholesterol, by an average of about 15 over 6 months. Blood pressure dropped by 4.5 for systolic and 3.1 for diastolic. There are research results showing that heart rate could be reduced by about 1.6 to 2.2 on average over 2 months. Lowering bad cholesterol by 15 and blood pressure by 5. As a doctor in practice, I realize every day just how difficult this is. Even with exercise or a strict diet, it barely goes down. Many people experience this. However, I don't really want to rely on medication. For those people, I think it's really important to consciously take omega-3 fatty acids like these. In addition, a meta-analysis paper was published that gathered multiple studies on whether administering this icosapentaenoic acid to people with depression could improve the effectiveness of depression treatment. When 1/2 of an ounce of icosapentaenoic acid daily were given to people with depression alongside their regular antidepressants compared to not giving it, there are reports that the improvement rate of depression increased. So it's not just about blood pressure or cholesterol. It's also expected to help with depression and is getting a lot of attention. It's a nutrient that originally comes from natural foods. I think it's even better if you can get them from a natural diet. However, it's quite difficult to consciously eat blue-backed fish. If you clearly eat less fish than usual, I think it's a good idea to consider taking supplements. According to the United States Food and Drug Administration, the general public can take a total of 3 grams of icosapentaenoic acid and docosahexaenoic acid per day, and up to 2 grams of that can come from supplements. And if you have your doctor's advice, it's said that you can take up to 4 grams per day. So I think it's safe to take up to 2 grams per day as a supplement. As for icosapentaenoic acid, which I mentioned earlier as highly effective even in Japan, it's actually used as a prescription drug to lower triglycerides. If you're concerned about triglycerides or cholesterol, consult your doctor to determine the right amount for you. There's one thing you should be careful about when getting omega-3 fatty acids from fish, and that's mercury. Mercury is a metal that accumulates in the bodies of fish through the food chain. Consuming excessive mercury while seeking omega-3s can lead to mercury poisoning, causing numbness in hands and feet, vision or hearing issues, and memory loss. And symptoms like headaches and dizziness can also appear. Generally, it's said that certain fish contain higher levels of mercury. Large tuna, splendid alfonsino, and swordfish accumulate mercury due to the food chain. Mercury levels increase. Fish with relatively low mercury include These fish, sardines, mackerel, and horse mackerel, may contain varying mercury levels depending on their country of origin, so caution is needed. And supplements are also made from fish as raw materials. Be cautious with supplements as they may have mercury, marine pollutants, or oxidized oils. That's why you need to be careful. From these perspectives, the supplement I actually use is the one released by Oaklean. It's a vegan docosahexaenoic acid and icosapentaenoic acid supplement. What's revolutionary about this supplement is that it doesn't use fish as an ingredient, so it doesn't contain any marine pollutants or mercury at all, and it's made for vegans. And the point is that it's made from plant-based ingredients. Actually, the reason fish contain a lot of icosapentaenoic acid and docosahexaenoic acid is because they eat seaweed. This supplement uses docosahexaenoic acid and icosapentaenoic acid extracted directly from that seaweed. Also, fish oil supplements, there's also no fishy aftertaste or smell coming from your mouth after taking it. You want something guaranteed safe since it's going in your body, and you should avoid oxidized oils and marine pollutants. This is a product I recommend for people who have those kinds of preferences. Of course, when it comes to supplements, it's really important to remember that, as the word supplement suggests, the idea is to make up for what's lacking. Consider your eating habits. You might be too busy to eat enough, or a doctor or nutritionist may have said you're missing something. Why not use these supplements to help prevent serious illnesses like stroke or heart attack, or to avoid developing them? If you're interested, check the product link in the description for more details. This time, I discussed 3 signs that plaque may soon clog your arteries. And I also explained about the omega-3 fatty acids, docosahexaenoic acid and icosapentaenoic acid, which are currently getting a lot of attention. At YouTube Medical University, we share data-based information. We share videos to help you get healthier starting tomorrow and prevent illness. I'll keep providing this information responsibly as a doctor. I would be really happy if you could subscribe to the channel so you don't miss any new videos. And whether it's the like button or the dislike button, if you could rate this video, it will help me for future reference. And in the comments section, please share what you felt, what you learned, and the healthy habits you're incorporating. I think it will be helpful for other viewers. Well then, see you in the next video.